Medical abbreviations, you either love them or you hate them. On the one hand, they make the never-ending documentation that contains words that are ridiculously long much quicker. But on the other, you're constantly swimming in alphabet soup, wondering if anybody else is going to understand what this means. Watch to the end for the translation. I thought I'd do something easy and light this week since everyone's probably busy with holiday prep. So we're going to have fun with medical abbreviations, and we're going to go over some of the common ones and maybe some that are a bit more challenging. So I was trying to find a way to make this video maybe a little more stimulating rather than just me reading a bunch of medical abbreviations and telling you what they are. But there was literally no way to do that. So without further ado. First up, mainstream abbreviations that you'll commonly use in basic charting. AC is before meals, ADL, activities of daily living, AMA, against medical advice, H&P, history and physical, HPI is history of present illness, I&O, intake and output, DC, discharge or discontinue, DNR, do not resuscitate, NKDA, no known drug allergies, ANO, alert and oriented, WNL, within normal limits, DX is diagnosis, HO is history of, SEs are side effects, RF, risk factors, NAD is no acute stress, UOP is urinary output, C/O or CC is chief complaint, ROS, review of systems, DX, diagnosis, DDX, differential diagnosis, IBW, ideal body weight, DOB, everyone should know, is date of birth, MVA, motor vehicle accident, EBL is estimated blood loss, CP, chest pain, SOB, shortness of breath, STAT is immediately, S/P is status post, such as a status post open heart surgery, FB is foreign body, ALS, BLS is advanced life support or basic life support. So next we're talking about abbreviations that have a little x behind them, like a lowercase x. So what I'm referencing here are these abbreviations, which include RX, SX, TX, and FX. So for our purposes, SX is the abbreviation for symptoms, TX is short for treatment, FX equals fracture. Most people see RX and they assume it means prescription, and in a way it does, but RX is actually an abbreviation for the Latin word meaning recipe. Another theory is that this stems from the days of telegraphed communication, where instead of a period meaning a full stop, which required more effort, they just sent another letter X, which was supposed to be easier. I don't know, isn't it still hitting a key? I don't understand why an X would be easier than a dot. Anybody out there, if you know anything about the telegraph, let me know. Anyway, and then the simplest explanation regarding the lowercase x is it's simply a stand-in for the missing letters in the word. Who knows? In my experience, usually the simplest explanation is the correct one. Next, we have systems, which will start with CB, or cardiovascular, GI for gastrointestinal, ID for infectious disease, NV for neurovascular, ENT for ear, nose, and throat, GYN for gynecology, OB for obstetrics, MSK for musculoskeletal. All right, next, anatomy abbreviations. So we have RUQ for right upper quadrant, LUQ is left upper quadrant, RLQ, right lower quadrant, LLQ for left lower quadrant. And we have RA, which is right atrium, RV, right ventricle, LA for left atrium, and LV for left ventricle. Right upper extremity is RUE. Left upper extremity is LUE. RLE is right lower extremity, and LLE is left lower extremity. ABD is abdomen. LUL is left upper lobe, talking about the lung here. Maybe, I guess it could still be the liver too. LLL is left lower lobe. CBD is common bile duct. OD is right eye, stemming from the Latin term oculus dexter. OS is left eye, stemming from the Latin term as well, oculus sinister. OU is both eyes, stemming from oculus utercu. Yep, anybody who knows how to pronounce that, let me know, because I'm sure I'm messing that up. I'm sure I'm messing it up. Anyway, HC is head circumference. Vital signs are next, with VS standing for vital signs. BP is blood pressure, T is temperature, RR, respiratory rate, SpO2 or SaO2 is oxygen saturation. Heart rate is HR, P is pulse, BMI is body mass index, HT/WT is height and weight. All right, so now let's go to lab abbreviations, and there are a million of them. So I'm just covering the most mainstream, really, the ones that you'll see pretty much every time. So first we have CBC, which is a complete blood count. And the next three refer to blood tests we do to look at clotting, which are PT for prothrombin time, PTT, which is partial thromboplastin time, and INR, which is international normalized ratio. Arterial blood gases are ABG. LFTs are liver function tests. HGB and HCT are hemoglobin and hematocrit. H&H also refers to hemoglobin and hematocrit. PLT are platelets. BMP is basic metabolic panel. CMP is complete metabolic panel. TNS is type and screen regarding blood type. T and C is type and cross, and this is regarding cross-matching blood, which detects the presence of antibodies in the recipient against the red blood cells of the donor. These antibodies attach to the red blood cells of the donor after transfusion and can cause a hemolytic reaction, so that's why we cross-match blood prior to administering it to you. Na is sodium, K is potassium, Ca is calcium, and UA is urinalysis. Okay, so on to imaging abbreviations. So we have CXR, which is chest x-ray, ABX, which is abdominal x-ray. But now, a side note, depending on the context of the documentation, some of these abbreviations have multiple meanings, and this is one of them, as ABX can actually mean the abdominal x-ray, or it can also mean antibiotics, which is how I more commonly use it. I don't really use it for abdominal x-ray, but anyway. MRI is magnetic resonance imaging. CT is computerized tomography. EKG/ECG is an electrocardiogram. EEG is an electroencephalogram. KUB is kidney, ureter, bladder x-ray. PFTs are pulmonary function tests. So next we're doing pharmacy abbreviations. And some of these I didn't know and found it kind of interesting. So AC means before meals, and this is stemming from the Latin anti-cibum. Cibum, C-I-B-U-M. Doing my best here. So before meals is AC. PC is after meals, standing for post. UD stands for every day, from the Latin quaque hora somni. And if I'm completely trampling on these pronunciations, drop a comment below. I have a feeling I'm going to have a lot of comments. Or maybe not. I don't know. Let me know. BID is twice a day. QID is 4 times a day. TID, 3 times a day. QHS is hour of sleep or at bedtime. QOD is every other day. PRN is as needed, and it stems from the Latin pro renata. PO is per os or by mouth. NPO is nothing per os, and os clearly is Latin for mouth if you haven't quite figured that out yet. SC or SQ stands for subcutaneous. IM is intramuscular, IV intravenous, and OTC is over the counter. Everyone should be pretty much familiar with that one. There's a few in here that I mean are probably very basic and I really didn't need to include, but you never know. So trying to do a complete list of what you would probably use right out of the gate. Next are medication abbreviations. And first we're starting with BB, which is beta blocker. CCB is calcium channel blocker. ACEI is an ACE inhibitor. NTG is nitroglycerin. ASA is aspirin or acetylsalicylic acid. ABX, antibiotics, and this is what I was referring to earlier. This means antibiotics here in this context. PCN is penicillin. TPA is tissue plasminogen activator, which is a clot-busting medication that we give within the first hour of a stroke. APAP or APAP is short for N-acetyl para-aminophenol, better known as acetaminophen or paracetamol, aka Tylenol. So if you ever get a prescription for, say, Tylenol with codeine, it's usually written as APAP with codeine, and that's what it means. Normal saline is NS. D5W is dextrose 5% in water, meaning that there's 5% glucose contained in this solution. LR is lactated ringers, which is also an IV solution. ETOH is ethylene alcohol. HCTZ is hydrochlorothiazide. MTX is methotrexate. MOM is milk of magnesia. OCP are oral contraceptive pills. PPI is a proton pump inhibitor. All right, on to diagnosis and condition abbreviation. CAD is coronary artery disease. HTN is hypertension. DM is diabetes mellitus. TIA is a transient ischemic attack. MI is myocardial infarction, also known as a heart attack. COPD is chronic obstructive pulmonary disease. PE is a pulmonary embolism. CVA is a cerebrovascular accident. ARDS stands for acute respiratory distress syndrome. CKD is chronic kidney disease. ARF is acute renal failure. ESRD is end-stage renal disease. CP, cerebral palsy. CF, cystic fibrosis. IBD is irritable bowel disease. IBS is irritable bowel syndrome. UC is ulcerative colitis. UTI is a urinary tract infection. PUD is peptic ulcer disease. GERD is gastroesophageal reflux disease, also better known as GERD. ICP is intracranial pressure. TBI is a traumatic brain injury. SBO is a small bowel obstruction. DVT is a deep vein thrombosis. VF is ventricular fibrillation. VT is ventricular tachycardia. PVC is a premature ventricular contraction. MS stands for multiple sclerosis. PD is Parkinson's disease. BPH is benign prostatic hyperplasia. RA is rheumatoid arthritis. OSA is obstructive sleep apnea. Next are treatment and care abbreviations. So BX stands for biopsy, and there's that little X again. ECMO is extracorporeal membrane oxygenation, also literally known as ECMO. And this refers to a technique of providing prolonged cardiac and respiratory support to a person whose heart and lungs are unable to provide an adequate amount of gas exchange or perfusion to sustain life. FNA is a fine needle aspiration. IND is incision and drainage. PT is physical therapy. OT, occupational therapy. BiPAP or BiPAP is bi-level positive airway pressure, and this is a ventilator setting. PEEP or PEEP is positive end expiratory pressure, also a vent setting. CPAP or CPAP is continuous positive airway pressure. CABG is coronary artery bypass graft, also known as CABG. IVIG is intravenous immunoglobulin. ORIF is open reduction internal fixation, which is the surgical repair of a broken bone. NGT is a nasogastric tube. POC means point of care. AKA, above the knee amputation. BKA, below the knee amputation. PPE is personal protective equipment. After the pandemic, I don't believe there's a single person on the face of the earth that does not know what PPE is. IUP is intrauterine pregnancy. Next, we're going to talk about practitioner designations and some of the certifications. Did I think I really had to put MD or RN in here? No, because most people know what they are, but I did. So PCP stands for primary care physician. GP is a general practitioner. NP is a nurse practitioner. RN, registered nurse. MD is a medical doctor. DO is a doctor of osteopathic medicine, which I believe Dr. Mike is a DO. I'm pretty sure. DPM is a doctor of pediatric medicine, and a PA is a physician's assistant, or you can also see it written as PA with a dash and a C, which just means that they're a certified physician's assistant, indicating that they've completed all of their training and passed their board certifications, which are essentially like the boards that MDs take after their residency is complete. An APRN is an advanced practice registered nurse. And now we've come to the fun part where we have reached abbreviations that are not exactly mainstream, but fitting in so many situations. And I haven't forgotten, I'm going to tell you, this means good-looking mom in room 4 with the funny-looking kid with symptoms same as last time and will survive the resident making scientific wild-ass guess. Okay, so if you stuck with me to the end and you're still here, consider this my Christmas gift to you. The following abbreviations, again, according to hcca/info.org, have actually been found in clinical documentation. First one, ABITHAD. Abithad? I don't know. Is for another blithering idiot, think he's a doctor. ADR, ain't doing it right. CTD, circling the drain. DAAD is dead as a doornail. FDGB is full dango boom. FF is frequent flyer. FLD is funny looking dad. FLK, funny looking kid. FOS, full of stool. We all know what that really says, but FOS, let's go with just full of stool. FTW is freaking train wreck. Gomer, or GOMER, is get out of my ER, popularized by the book The House of God. Great read, highly recommend it. LOLINAD, Lolinad, little old lady in no acute distress. MFC is measure for coffin. Yeah. SALT, same as last time. Swag, scientific wild ass guess. Teeth, tried everything else, try homeopathy. TMB is too many birthdays, and TTGA, told to go away. Thank you. Merry Christmas, everyone. Merry Christmas. If you made it to the end, hit like and subscribe and turn on notifications. It would be a great Christmas gift for me. It's no cost to you, and it really helps us out tremendously to get these videos and this information out to people who actually may need it. So go ahead, hit it.